Good afternoon, everyone. This is Evelyn Mantilla. I think we have a good number of participants today. I am coming to you from Access Health, Connecticut, and I welcome you and appreciate you taking the time to join us for today's conversation. I want to do a little bit of housekeeping first before we begin the actual webinar. I ask you to please keep your audio muted for the duration of the webinar. This is important so that we don't get confusing audio coming through. Also, please know that we will answer your questions at the end of the presentation. If you have any specific questions, please type them in the chat box, and we will be answering them at the end of the webinar. If you're experiencing any technical difficulties with your audio, you can call from your phone number to the number that's here on the screen. And lastly, to let you know that the webinar link and presentation will be made available online for future reference at the learn.accesshealthct.com/community website. So with that, if you give me a moment, I want to make sure that we have recording in place, and it looks like we do. Therefore, I'm happy to introduce you. The way that today's webinar is going to work is first we're going to have a few words from Deborah Eastman, who is the broker, community partner, and call center manager. Deb, are you there? I welcome you.
Good afternoon, everybody, and thank you, Evelyn. Guys, thanks so much for joining us this afternoon. I just wanted to share with you a little bit of information that I have as of current today before Katie gets started. And one is, I've had lots of different questions from the brokers regarding who pays the commission, whether Connecticut or Anthem. And I have been in talks with a couple of different folks from Anthem, and they are still evaluating how they're going to handle this special event. So as soon as we hear back, which they have committed to a 2 business day turnaround, we will make sure that we share it with the brokers. But at this point, it's uncertain how that's going to go. So just wanted to keep everybody advised of that. And then also I have received several different concerns about brokers helping out with their clients that may have lost their job or loss of MEC and are going on Medicaid, and what happens when the situation changes and they come back onto a QHP. I'm aware of the problem. I've made my supervisor and managers aware of it. We're trying to figure out how that's going to play out in the future, but I honestly don't have any answers right now. And as I hear more and as we gather more information, I will keep all the brokers informed. But that's it for me, and I will turn it over to Katie. Thank you again, everybody, for attending.
Thank you so much, Deb. Really appreciate those words. And so, yes, now we have Katie Hearn, who is the Training and Quality Assurance Manager. Katie, I should move on to the first slide, correct?
Right. Thank you, Deb. Thanks, Evelyn. Hi there. So since last Thursday, we have been receiving a lot of calls about this new special enrollment that Access Health has opened up. The call center has been very busy. We are running this new special enrollment for anyone who does not have medical coverage right now due to the COVID-19 situation. So anyone who is currently uninsured or not covered can enroll at this time and can enroll through April 2nd. Anyone who is enrolling between March 19th and April 2nd who is uninsured and qualifies for a qualified health plan will be granted an April 1st effective date. So it's a little unusual, even if they enroll on April 2nd in a qualified health plan, they will be given an April 1st effective date. What is necessary to achieve this special enrollment, if you will, is a call to the call center. It is not possible to enroll in a qualified health plan online through the consumer portal without the assistance of the call center. We have trained a number of employees to create that April 1st effective date for those who qualify for qualified health plans right now. And you will need to ask the assistance of the call center to achieve that effective date. Next slide, please, Evelyn. Okay, so there's kind of a lot to think about with this. Many things are the same. Medicaid and CHIP enrollments work as they always have. There's no change there, but there are a number of things to keep in mind if you are looking to enroll someone who does not have a traditional qualifying life event right now, but is looking for coverage. So those who do have traditional qualifying life events can still enroll in the usual way. Whatever their QLE is can still be entered in the application, and that will still result in a qualified health plan enrollment. So if someone does have a loss of minimum essential coverage, for example, they can enroll through the consumer portal at this time using loss of minimum essential coverage as usual. But for those who do not have those traditional qualifying life events, you will need to work with the call center. One thing that we ask is that you ask your clients if they have any other medical insurance. We did not open this SEP for people to enroll in secondary health coverage. So if you enroll in a qualified health plan through Access Health at this time, it is assumed that you don't have another insurance plan. A plan through Access Health is not meant to be used as a secondary health plan. Okay. As usual, when updating an application, it's really important that both annual and current monthly income is up to date, and that we have the household's most recent address. Just make sure that the monthly and annual income makes sense. Those sections are very important because they have a huge impact on eligibility, whether someone is eligible for Medicaid or for a qualified health plan with tax credits, et cetera. Please make sure that you have those income sections up to date. Also, please remind consumers to pay their initial premium. We would hate to have them set up for the 4-1 enrollment only to then be canceled for non-payment. So please remind your clients to pay that initial premium, to reach out to the carrier if they have questions about their invoice. Okay. As I said, you will need the assistance of the Access Health call center to enroll those who are uninsured, who do not have traditional qualifying life events. And for now, this is running through April 2nd. We don't know if it will be extended at this time. The call center number is listed here. And there are licensed brokers available to assist with plan selection through the Access Health call center. So when we did a webinar last week, we were asked if call center representatives would be assisting with enrollments, and they won't be assisting with plan selection. If someone is uncertain about what plan to buy, they will be referred to a licensed broker. Okay. If you are a broker of record and you wish to assist your client with plan selection at this time, please ask the call center representative that you're speaking with to document that in their notes so that it's clear that you wish to assist the client, and make sure that they have your best contact information documented. As far as the Tango process goes, or associating with your client, that process is the same. It's just that and the call center can assist with linking applications if necessary. So if the call center started an application for a consumer and later the consumer creates a consumer portal account, the call center can assist with that linking process as per usual. But just keep in mind that the Tango process is basically the same. It's just that you're not going to be able to get that 4-1 effective date without the help of the call center. The special enrollment does not apply to standalone dental plans. There is no new special enrollment for the Anthem dental plans that are offered through Access Health. Doesn't apply to dental. And just as a reminder, when we say anyone who is uninsured can try to apply for qualified health plan coverage right now, we mean it. So that means even those who may have been formally terminated this year for non-payment or for verification issues, they can enroll between now and April 2nd. Okay, next slide, Evelyn. Thank you. Our marketing department has put together some resources for you. And Keisha, would you like to speak to this?
Hi. Yeah, sure. So all of you who are in the webinar, you should be receiving our email updates. If you're not, please say something in the chat just to make sure. That is how you probably found out about this webinar. That's how we've been sending out a lot of our marketing information, and you'll find in there some FAQ documents. Of course, we'll invite you to any future opportunities like this. And we've shared some images and other things that could be shared on your own social media pages, or if you're part of an organization on that page. There's FAQs, like I mentioned, on our regular Learn More site. And you'll also see contact information for the insurance companies, because we are encouraging for you, if you're receiving questions from current customers, if they have questions about their plan or how to use it, we're really pointing them right in the direction of their own insurance company. So that information is on that page as well. I think that's about it for this page.
Terrific. Thank you, Keisha. I'll check in with Katie one more time. Is there anything else that we want to complete with the presentation?
No, thank you. I think we can proceed to questions and answers.
Terrific. So let's get to questions and answers. As a reminder, please type any questions that you may have on the chat box that is part of your Zoom program, and I will be able to read them and have the staff respond to them. We do have one question/comment that I think requires a response, and it goes like this. I called the call center yesterday, and the representative stated that there are still qualifying events to qualify for this special enrollment period, and that my client didn't qualify for it, but she currently has no coverage.
Hi, Evelyn, this is Deb. I'm not sure all the circumstances regarding that call, but the best thing to do would be for the broker to send that through to the broker support, and we'll take a look at that immediately.
Okay, so send the information through the broker support.
AHCT broker support at CT.gov.
Terrific. I'm sorry, Deb, can you repeat that for broker support?
Certainly, it's AHCT broker support, all one word, at CT.gov.
Terrific.
And Evelyn, one more thing, I just want to reiterate what I said at the beginning of the call, that Anthem is evaluating whether to pay commissions for this special enrollment to be determined within 2 business days from today. And then also we are looking at the situation where the consumer was with a QHP, has gone out because of the situation that they're in currently, and what happens if they come back in with a QHP. So more to come on that as I know more and as we research more on that.
Terrific. Thank you. Thank you, Deb. So yes, that's a great reminder that we know that a number of brokers have questions about commissions during the special enrollment period, and that is what is being looked at, and hopefully we'll have information for people rather shortly. Another person is asking, and I can answer this question very quickly, is this presentation going to be made available after the meeting? And yes, the answer is absolutely. It will be made available through the Access Health Connecticut community website, which is learn.accesshealthct.com/community. So we look forward to posting it for anyone that may need to be able to see the full webinar as it was recorded. All right, we have another question. Is the info sheet to share will be sent via email soon? I'm not clear what info sheet it may be, but let me know if we can provide an answer to that question.
Evelyn, this is Deb. I'm not sure what what sheet they're speaking about? Was that the Q&A or is that, I'm not sure what.
I see. So for the person who posted that question, if you can give us a little more clarity, that would be great.
I will say everybody who is registered for this a webinar, you will receive the presentation directly, as well as the FAQ that's posted on the website. So you can either access it directly on the learn.accesshealthct.com website, or you can wait and we'll be sending that to your email shortly.
Hi, this is Keisha. My microphone wasn't working. I used the chat box, but the info sheet that we're talking about, it's the bilingual sheet that you will receive at the end of the webinar when we send the materials out. Just wanted to confirm that.
Terrific. Thank you. Thank you. Really appreciate that, Keisha. Very good. Okay. Let me look at other questions that may be coming through. Someone does want to know if broker support will send an update once we hear from the insurance companies regarding payment of commissions.
Yes, this is Deb. Yes.
Excellent. Thank you. I'm still looking for other questions. Someone does want to know, still on the same subject, I apologize, but I want to make sure there's coverage and full feedback. But someone wants to know if that the conversations with the insurance companies applies to Connecticut as well.
Hi, this is Deb again. Connecticut has confirmed they will be paying commissions for the SEP.
Okay,
Yes.
terrific. So we're waiting on Anthem.
Correct.
All right, very good. I appreciate that. Let me remind everyone that if you have any further questions, please type them in the chat box. As your moderator, I'm prepared to read those questions and get you an answer. And also to point out to you that in the chat box, we have included the emails that you can send your questions to further on, as well as the website, which is the learn.accesshealthct.com website for all of your most pertinent and most recent information. I see that we have, for example, for brokers to contact us, AHCT broker support at ct.gov. That's your email address. And for the CACs, you should contact us at ird.outreach@ct.gov. Very well. I'll give one more opportunity for any questions that you may have. Please type them in the chat box and I will make sure I read them. Okay, very well. I don't see any other questions coming through. I'm hoping that this information, it means that this information was complete for you and answered your questions. Before I close the webinar, I want to make sure that everyone knows that we not only appreciate your concern and your time to participate in today's webinar. On behalf of Access Health Connecticut, we also want to remind you that we want you and your families to be well, be healthy, and take good care of yourselves during this very challenging time. Access Health Connecticut is here to help, and we are coming together mostly from our homes to distribute the information that's necessary for everyone as quickly as possible. So once again, I thank you for your time. We really appreciate you taking the time to be part of this conversation today. And with that, I still don't see any other questions coming through. So I am going to close the webinar. Thank you and have a great afternoon, everyone.
Thank you.
Thanks all. Stay safe.
Thank you.
Thank you.